Kavanagh with Health Watch USA.
Well, thank you very much. We need to have a paradigm shift regarding the prevention of infections of multi-drug resistant organisms, one which is designed around the prevention and promotion of an optimal protective microbiome. Antibiotic stewardship, although very important, probably will not succeed as sole intervention. If a 50% reduction is achieved, there will still be billions of bacteria exposed to antibiotics. Resistance will still develop, but hopefully at a slower rate. The importance of the microbiome, along with antibiotic stewardship, is demonstrated by an up to 32% reduction observed in C. difficile infections with proper prescription practices. This reduction is primarily due to the avoidance of the destruction of the gastrointestinal tract's beneficial bacteria, which help prevent the acquisition and growth of C. difficile, along with the development of resistance. The most effective treatment for severe C. difficile infections is not antibiotics, but microbiome reconstruction with fecal transplantation. Identification of carriers is also of importance. Currently, the World Healthcare Organization recommends preoperative testing for Staph aureus for all patients undergoing major surgery. And in countries with adequate resources, which certainly the United States has, they recommend the testing of all surgical patients. In the United States, there is not even a system-wide standard to preoperatively identify MRSA carriers, which could then allow for their decolonization. I envision that in the future, hand hygiene will evolve and take on a different form. Instead of destroying a hand's microbiome over 200 times a day, risking exposure to the facility's microbiome at the same time, I feel that it will take on a form which will be a more selective approach, performing microbiome destruction when exposed to dangerous pathogens, and in other cases, performing cleansing, which includes beneficial and protective bacteria. I cannot overstress the importance that our healthcare system prepare for the testing of a patient's microbiome. In the future, I believe that this will be part of a standard physical examination. Knowledge of the microbiome's characteristics will be an important part in addressing many different types of diseases, not just infectious disease. We need to build this capability. But until then, we can at least identify the carriers of dangerous pathogens in an attempt to eliminate this carriage and to modify their microbiome. Thank you.